So hello and welcome to today's episode of the Men's Health Hub, where we're going to be diving into a condition that often goes unnoticed but impacts many. It's called chronic pelvic pain syndrome, CPPS, and it's a persistent pain in the pelvic area that can affect your daily life, your sexual health and your mental well-being. And let's break it down and explore some of the causes and look at the evidence-based treatments, both conventional and natural, as a way to navigate the terrain here. Firstly, what is CPPS? Chronic pelvic pain syndrome is defined as a persistent pain in the pelvic region lasting longer than 3 months. It's without a clear infection or other identifiable cause, and it's a form of prostatitis, and it's unlike bacterial prostatitis. It's not caused by an infection. So this is a condition that affects men of any age, and it can be accompanied by symptoms affecting urination, ejaculation, and overall quality of life. The symptoms of CPPS can vary widely, but they often include persistent pain in the pelvis, the perineum, or the lower abdomen. It can be painful to urinate and painful to ejaculate. There can be a constant urge to go to the toilet, and there can be feelings of an incomplete bladder emptying. Quite often people will complain of low mood, and they can have like a chronic discomfort. It can take its toll on mental health and on relationships, making it essential to really seek early intervention. So the exact cause isn't clear, as I mentioned earlier, but the research points to several potential factors. There can be musculoskeletal dysfunction, which is like a tightness or a dysfunction of the pelvic floor muscles, and that's a significant contributor. There can be nerve sensitization. So this is overactive nerves in the pelvic region that can heighten pain sensations. There can be chronic inflammation. Whilst it's not always to do with infection, there can be inflammation in the prostate and nearby tissues which can perpetuate the pain. There can be psychological factors such as stress, anxiety, and depression. And there can be lifestyle factors such as prolonged sitting, poor posture, or repetitive physical strain that can contribute. Now, a study published in the Journal of Urology emphasized the multifactorial nature of CPPS, suggesting a need for comprehensive and a multidisciplinary treatment approach. Conventional treatment tends to be personalized. It will involve medications such as alpha blockers like tamsulosin to help relax the muscles of the bladder, the neck, and the prostate, easing urinary symptoms. They will involve anti-inflammatory drugs to reduce the inflammation and the pain, and antidepressants or anti-anxiety medications to address the psychological component of CPPS. And it may help nerve-related pain as well. You would be assessed for physical therapy, and that will involve pelvic floor therapy. Now, in practice, I have seen this being really effective for this condition. It focuses on releasing tension and improving the muscle function in and around the pelvic floor. And studies in the International Journal of Urology highlight its effectiveness in also reducing pain. You may need to go through some bladder training. So this is a structured exercise to help improve your bladder control and reduce urinary urgency. You can have trigger point injections. So this is localized injections for muscle pain, which can provide really significant relief. But there are natural and functional approaches to this. So complementary therapies can play a valuable role in managing CPPS, and let's discuss some of those. Palmetto, known to support prostate health, may also alleviate urinary symptoms. And that's according to the Cochrane database, which indicates it as a potential benefit for prostatitis and proctitis. Quercetin is a powerful antioxidant, and it reduces oxidative stress and inflammation. The study of urology found it effective in relieving CPPS symptoms. Turmeric, which is famous for its anti-inflammatory properties, and its constituent curcumin has shown promise in reducing pelvic inflammation. Pygium africanum is a herb that improves urinary symptoms and supports overall prostate function. Now, on to nutrition. You want to include anti-inflammatory foods like salmon, walnuts, and leafy greens. You want to avoid irritants such as caffeine, alcohol, and spicy foods, which can aggravate symptoms. You want to ensure that you're drinking enough water. That helps flush out toxins and help maintain bladder health. When it comes to stress and stress management, so practices such as Tai Chi to help you moving that focuses on deep breathing and pelvic floor can be really helpful. Exercise like walking, swimming, and stretching can help improve circulation and muscle relaxation around the pelvic area. Living with CPPS can feel isolating, but mental health support is crucial. Cognitive behavioral therapy, CBT, has proven effective for chronic pain management, and it helps reframe negative thoughts. Developing coping strategies and talking openly with a therapist and joining a support group has provided much needed relief. It's a condition that is chronic. It is difficult to manage. It's difficult to talk about. And even some of the consequences of the condition make it embarrassing for people to talk about. But there is little doubt that talking about it can actually alleviate some of the symptoms. So I would encourage you to seek out help from a practitioner such as myself or other specialists in the field. Hope that's of use. Cheers.